Do you ever have trouble concentrating? Do you ever find it difficult to focus on one task? Have you ever wondered what ADHD is and what are the signs and symptoms to look out for? Then keep listening as we give you an ADHD guide for dummies in the next few minutes. Hi, welcome back to the channel. My name is Dr. Aziz. I'm a psychology graduate of Cambridge University and also a medical doctor. In this video, I'll be covering ADHD or Attention Deficit Hyperactivity Disorder. We'll be covering what causes ADHD, at which age this can occur, what are the typical signs and symptoms, and what you can do about it. Also, different to some of the possible signs of ADHD videos you may have come across, I'll explain the exact criteria that we as doctors use to diagnose ADHD. So what causes ADHD? The exact cause of ADHD is unknown, but the condition has been shown to run in families, so there may be a genetic component. Other factors suggested as potentially having a role in ADHD include being born prematurely, having a low birth weight, and smoking or alcohol or drug abuse during pregnancy. ADHD and age. Now, the symptoms of ADHD tend to be noticed at an early age, and most cases are diagnosed between the ages of 3 and 7. Given that it's a developmental condition, it is unlikely ADHD develops in adulthood, but it is perfectly possible that ADHD is not diagnosed in childhood and continues into adulthood, with a diagnosis being made later on in life. ADHD signs. The signs of ADHD can be categorized into two broad categories. One is inattentiveness, i.e. difficulty concentrating and focusing, also known as ADD, Attention Deficit Disorder, and the second is hyperactivity or impulsiveness. Some people with ADHD will fall into one of these two categories, while others may have features from both. Now, the criterion most psychiatrists use around the world, in the USA and other countries, is called the DSM-5. Here in the UK, we generally tend to use something called ICD-10. But for ADHD, most of our guidelines, called NICE guidelines in the UK, also refer to DSM-5. So basically, we can consider this the gold standard criteria. So again, looking at this document with the criteria, we see that to diagnose, we need to have symptoms or signs that have persisted for more than 6 months in more than 2 settings, e.g. school, home, church. Symptoms have negatively impacted academic, social, and occupational functioning. In patients aged under 17 years, we need more than 6 symptoms. In those aged over 17 years, we need more than 5 symptoms. So then we have the symptoms required for type 1 inattentive type criteria. So the patient displays poor listening skills, loses or misplaces items needed to complete activities or tasks, sidetracked by external or unimportant stimuli, forgets daily activities, diminished attention span, lacks ability to complete schoolwork and other assignments, avoids or is disinclined to begin homework or activities requiring concentration, and fails to focus on details and or makes thoughtless mistakes in schoolwork or assignments. In terms of type 2 of ADHD, hyperactive or impulsive type, the symptoms required for diagnosis include squirms when seated or fidgets with feet and hands, marked restlessness that is difficult to control, appears to be driven by a motor or is often on the go, lacks ability to play and engage in leisure activities in a quiet manner, incapable of staying seated in a class, overly talkative. Impulsive symptoms include difficulty waiting in turn, interrupts or intrudes into conversations and activities of others, impulsively blurts out answers before questions are completed. Now, the additional requirements are mostly for symptoms to be present prior to age 12 years, symptoms not better accounted for by a different psychiatric order such as anxiety or schizophrenia, and symptoms not exclusively a manifestation of oppositional behavior, i.e. not just teenage rebellion. So what can be done about ADHD? First and foremost, you need a diagnosis, whether that's for your child or for yourself. To help with a problem, we need to clearly define what the problem is. Secondly, there are various medications, including methylphenidate and atomoxetine, which can help with the symptoms of ADHD, as well as various therapies such as CBT, and in general, a healthy lifestyle with lots of exercise and a balanced diet. Some people have found that there may be trigger foods, so keeping a diary here would be useful. There is no cure for ADHD, although some symptoms may fade into adulthood. ADHD is a lifelong diagnosis. That being said, many people with ADHD, with the right support, help and treatment, live very productive and fruitful lives. Do you have ADHD, or do you know someone who has ADHD? Post your thoughts or experiences down below. Anyway, I hope you learned something useful and enjoy this summary. If you want to keep learning about psychology, medicine, or life hacks, hit the like, subscribe, and notifications button. Any suggestions or comments, feel free to post below. Until next time, stay safe.